99.3 Nigeria Info.
.3 Nigeria Info. Lovely morning to you, Lagos. It's time for us to get talking on the crossfire. We're broadcasting live from Victoria Island here in Lagos, Nigeria. This morning on the show, we'll be talking about something really interesting, a report done by Wemimo Adewuni. If you haven't seen the report, if you haven't read the report yet, we'll be putting a call through to Wemimo in a moment, and she will be on the show to talk to us about her report. In the meantime, do know that you can join the conversation live right now on Facebook. That's Nigeria Info 99.3 on Facebook. Nigeria Info 99.3. Go there and be a part of our conversation right here, right there, right now. You can also watch us live on YouTube. That's right. You can watch us live on YouTube. Nigeria Info 99.3 on YouTube. That is Nigeria Info 99.3 on YouTube. Feel free to track this conversation on Twitter as well at Nigeria Info FM on Twitter, at Nigeria Info FM on Twitter. You can stream us live from our website. It's Nigeria Info FM, nigeriainfo.fm. That's our website, nigeriainfo.fm. It's our website. Now, Nigeria's COVID-19 cases continue to skyrocket, continues to grow. Right now, there are more than 20,000 cases, approaching 21,000. Now, while we know that healthcare in Nigeria is below the standards, we know that. The pandemic has since underscored this fact, no doubt about it. Wemimo Adewuni is a senior editor, advocacy and gender issues, and a reporter here on Nigeria Info, who happens to be my very sweet, dear colleague. She visited a primary healthcare center and made some findings. She documented it in a report titled Lagos Healthcare Center Without Clean Water. That's how she documented that report. You can find that story on our website, nigeriainfo.fm. It is the first in a series titled Where is the Water? That means you hear more from Wemimo. Be sure to stay glued to our website for more on those. So she joins us right now on the show this morning to tell us about it. Wemimo, a very lovely morning to you.
Good morning, Sheriff. Good morning, everybody.
It's
good to be here.
It's good to hear from you. How are you?
I'm good. Been home for a while, lockdown, and then the other thing.
Yeah, the other thing. How is the other thing?
The other thing is good. It's good.
You can't go away now. How is the baby, Jerry?
You finally put it there. The baby is fine. The baby is very fine. We're doing well. We're having some sleepless nights.
Yeah.
Hey, we're doing well.
That's great. Now, you had a report that you have published already. Such a fantastic report. I've read it. What inspired it actually?
Okay, so I wanted to start this water series just before the lockdown.
Right.
But being the way I was pretty heavy. I couldn't move around as much as I wanted to. But I incidentally had to visit a health center some 2 weeks ago.
Right.
So I have a habit of looking around for health centers where I stay.
Okay.
Visiting the closest one to me, I realized it was shut down. I'm told for some reconstruction. I looked for the next one, and later found out also that it was later also shut down for some reasons. I believe that a COVID-19 case was discovered there. Okay. According to one of my sources from the council, one of the doctors came down with COVID-19.
Oh.
And the nurses are under quarantine.
Oh.
So the health center is shut. The next one is the one I then visited, the Ashogbo Health Center. I was asking people around, where's the next one?
Right.
I wanted to know how easily people could access healthcare during this COVID-19. And I see from there that, in fact, looking at the building, you would not think this was a health center.
Oh, wow. What did you see? How do you mean when you say that you would not think it's a health center?
Well, have not made Lagos roads any, we can't cover up anymore. We can't do makeup anymore. The roads are bad, especially the inner roads in some areas. In that area, the inner road was really bad. I drove an SUV and I practically swam through some areas before I got there. And potholes. In front of the health center, there's a large ditch filled with water. The gate, the inside of the compound also has overgrown weeds, so it really didn't look like a place that was functional. But there was a gate man there who tells you can come in, the place is open for business.
But you said that it doesn't look functional, but it was functioning, right? Or it is functioning?
They told me that it is functioning. Once I introduced myself as a press lady, they were a bit more guarded in answering my questions. But I took some pictures, which our listeners can check out online on nigeriainfo.fm.
Right.
I took some pictures of the inside of the health center. You take a look at it and tell me if you think that looks functional. I saw beds packed to one side in a room that ought to be the ward.
Yeah.
It didn't look like it had been used in a while. So, like I said, the compound is overgrown with weeds. But the nurses tell me they keep working in that situation.
Yeah.
But the most important thing and the most worrisome thing is that this health center does not have running water. By the time I got in, face mask is compulsory.
Yeah.
I walked in, the tap bucket put up on a stool where you're supposed to wash your hands once you step in. The water was finished. I had to tip the bucket over. No water was coming out.
Right.
The gate man came over to help, and then I discovered that the water was extremely dirty. So I asked him, how do we wash our hands with dirty water in a health facility? And then he tells me how their water situation has been. They've been without a functional pumping machine for a long time.
Right.
So they buy water whenever they can. The other time they just survive. Thankfully, it rained overnight, so they fetched some water from the rain. And that's what they had to manage for the day.
Did you see any other patient there when you went there, when you were there?
Yes, it was immunization day.
Okay.
So I brought my baby along for immunization that day also. And so I saw there that all the patients there, all the parents, they weren't patients, all the parents who had come for immunization, brought their babies, had to wash their hands. And of course, when the water finished, that's the end of hand washing for that day.
Oh my.
Yes. So the pumping machine is not working. They don't have water. And, it worries me that with the high cases of COVID-19 reported every day,
right, and
one of the most useful advice that we're given is to wash our hands frequently,
regularly,
and thoroughly.
Right.
Absolutely.
Right. I read your report, Wemimo. You spoke with a Lagos State, the local government a local government official who told you a few things. Tell us what he told you.
So I challenged him about the water situation, and that's the media spokesperson to the chairman of the local council development area.
Right.
That's the Bariga local council development area. At first, he told me he didn't know about that situation, but when I pressed further, I think he asked a few questions from some other people.
Right.
I told him I wanted a balanced story before going to press. He told me that they really do not have water, and the reason he gave is that health center is close to the lagoon. It's close to one place called Ebute. I haven't been there before, but I asked around. So I think that affects the quality of the water they have from the ground.
Okay.
I asked him if any other alternative was provided, saying that water is important, especially in a health facility. Imagine treating patients, imagine taking deliveries, because primary health centers are meant to take deliveries.
Right.
How do you take deliveries of babies without running water? He said some tankers were meant to deliver water to this health center, but he couldn't give me a schedule. I asked him, what's the schedule? What's the plan on ground? How often is this tanker meant to go there? He didn't know. He said, well, there's some money given to the health centers for maintenance. So they should take some of that money and buy water.
So invariably, he just told you what the health center told you, that they buy water sometimes.
Yes, they buy water. Unfortunately, because of the rains and the bad roads, the cart pushers would not come. You know, it's easier for them when the roads are dry to push water. But once the roads are messy, like it currently is, with the ditches, the cart pushers don't come. So ourselves, the parents who were sitting, and the nurses themselves were washing our hands with this dirty rainwater.
Oh, my.
Their roof was quite dirty. The water was really filled with dirt. And we had to all just use that to wash our hands.
You know, one thing that actually comes to mind easily with this report, because when I was reading it, my mouth remained opened all through, because even though I am a guy, I can't imagine taking my baby to such a place and feel safe. I want to ask you, I mean, you obviously weren't comfortable with what you saw. There were other mothers there as well. Did you see them like they didn't see anything wrong with what was going on with the state of things at that health center? I mean, you saw them. What did you see?
Well, somehow it's really worrisome, but it appears that some people get used to abnormality. It's really worrisome. You know, in the first place, many of them did not even want to wash their hands. Many of them did not even bring face masks along. They had to be sent back at the gate. Some of them went to buy handkerchiefs to cover their faces. I had to take my baby there because, as a journalist, I needed an entry point.
Right.
I wouldn't be allowed in unless I had something to do. You know, right now you can't go to hospitals.
Absolutely.
Yes, you can't just walk into a hospital and sit around. Right now, the fewer people at the hospitals, the better. So when NCDC tells us, don't go to the hospital if you feel sick, stay at home and then take advice. But some people still need to go to the hospital. Some of the parents I spoke to, their children had missed immunization because the closer health center to them, the CMS, has been shut down because of the COVID-19 case.
Right.
So if these babies keep missing their immunization, it's because the immunization is timed, it's a big problem. But if we then have to go to one health center that's working, it should be functional. And water is very important in reducing the spread of COVID-19.
I don't know how other health centers are in Lagos. I know the one in Festac is quite okay and standard. I know the one I think in Badore or something is also quite okay as well. But I would like for us to take a few calls in and get feelers from Lagos this morning. If you have visited a health center before, number one, we'd like to know the infrastructure that you notice. Do they have light? Do they have water? Do they have personnel? On the ground? Do you feel safe as a mother or as a person going to these health centers? We'd like to know exactly what the situation is. But before we get to the phone lines, let me put something out there right now. So components of the budget, our budget in this country, actually directly affect the health sector in Nigeria. Because right now, this year, we have about 44.5 billion naira earmarked for basic health care provision funds. It's called the BHCPF. Now, the goal of the fund is to substantially increase revenue and improve primary health care. This same primary health care that is in jeopardy right now, especially in these two, particularly in this one that we're taking a look at. So talking about the National Health Act, which is quite important, this Health Act is meant to provide a framework for the regulation for how development and management of the national health system will be carried out. And for the very first time in the history of this country, this National Health Act sets primary health care provision standards, which means that there are acceptable standards when it comes to primary health care. Let's see if these standards are all over or this is just peculiar to Ashogbo Primary Health Care Center alone. Princess is here from Aja. Hi, Princess. Good morning to you.
Hello, good morning, Sheriff.
Good morning.
Good morning. How is Wemima?
Wamima is fine. Oh wow! I think we lost Princess's call. Oh wow! Princess, do call us back if you can. Do call us back. We would like to hear from you. But let me quickly wrap off. Let me quickly wrap off with this. So the National Health Act also created the Basic Healthcare Provision Funds, which legally guarantees a minimum 1% of consolidated revenue from the federal government, specifically to strengthen the primary healthcare structure. It seems as though we have taken for granted the primary healthcare in Nigeria, not just in Lagos alone. Not just in Lagos alone. It seems as though we've taken primary healthcare for granted. It seems as though nobody really cares about primary healthcare. We feel that primary healthcare should just be for immunization, antenatal. Yeah, it's good, it's okay. But majority of the things that we go to secondary and tertiary health facilities for can actually be taken care of at the primary healthcare level. Right? And that is exactly why we're talking about this particular conversation, why we're having this conversation this morning. Wemimo Adewuni is senior editor here on Nigeria Info for Advocacy. And she started her advocacy. Wemimo, very quickly, this is a series that you have started. What is the next port of call right now? I mean, I hope that we will be able to follow this particular revelation that you have brought to the fore with your report. I hope that we'll follow it to a reasonable, logical conclusion. But going forward, what is the next port of call for you?
Well, I will be following this story very keenly. They also promised that they would look at the issues very quickly. And if I might mention, I should say that the Lagos State government has done quite a lot in terms of primary health care compared to about 10 years ago.
Yeah.
I think starting with the past administration, there's quite a lot of focus on developing primary health care. But Lagosians especially are still used to going to general hospitals for fever, headaches, checking body temperature or your blood pressure.
Right.
Things that should be done at the primary health care centers. So now it's about increasing the confidence in these primary health care centers. There are about 57 flagship health centers that work about 24 hours a day. There are also, I gather, about 288 primary health care centers across Lagos.
Right.
Some of them are okay and functional. Most of the time I asked about, do you have a laboratory to run tests? Do you have doctors always on ground? And some of them pass these checks. But there are some in interiors that still need some attention. And
Right.
the Asogbo Health Care Center is one of them. And this is what this story highlights. Going forward, I'll be following up on this story with the council to ensure that they provide them with pipe-on water, running water, and also be looking at other parts of the sector affected by the lack of access to clean water.
Right.
According to WaterAid, 3 out of 10 Nigerians
Absolutely.
do not have access to clean water. That's huge.
That's big.
So I'll be following this forward in different sectors, and I'll be bringing this report back to you.
Wemimo Adewuni, thank you so much for talking to us on the Morning Crossfire today.
Thank you so
And
much,
and
Eric.
cuckoo check to the baby.
Yes.
It's nice hearing from you. Lagos, there you go. Our own Amanpo Wemimo Adewuni doing what she does best. Advocacy. We'll be talking about that in a moment. We'll get more reactions from you in a moment. Feel free to jump on this conversation. If you visited a health center before, a primary healthcare center before, let me know what you saw, what you found out. Was there a doctor on the ground? Did you see nurses? Were you attended to the way you felt that you should have been attended to? Were you disappointed? What was your experience like holistically? What was your experience like when you visited a health care center? 8:23 is the time from our studios, and for you to catch up on that particular report, you can go to our website, nigeriainfo.fm. You'll see pictures interesting pictures, all done, taken by Wemima Adewoni herself. The report is titled Lagos Healthcare Center Without Clean Water. You can just find out. Nigeria info.fm, that is our website. You see, just scroll down where you see reports, and then you can then click on the report and read up on it. It's quite detailed. You see pictures of the gates of the health center. You see picture of somebody fetching rainwater. You see picture of the bucket that is being used to wash hands. Quite. I don't know. Esther is here. Let's talk to Esther. Hi, Esther. Good morning to you.
Good morning, Sheriff.
Good morning.
How are you doing?
I'm doing okay. How are you?
Yes. I want to talk about this health center at Ikotun.
Okay.
At Mabaronje, Okerube.
Hmm.
The health center is very, very bad. Just like uncompleted building. If you can even go there, you see bushes all around, everywhere unkept. Even the children that they are giving immunization, the mother and the children will be under one hot pan like this. Very, very bad. No running water, nothing. They accommodate up to 100 people a day.
Oh my word.
Which is very bad.
Yeah, that's not good. That's not
Please,
good.
I would like the government should just look into that.
What is the area again? Ikotun Abaronje.
Yes. Okerube.
Okerube. Okay.
Yes.
Okay. All right. Esther, thank you for sharing that information. It's very, very important. Michael is here. Hi, Michael. Good morning to you.
Good morning.
Good morning.
My name is Michael, calling from Ikotun.
Michael, welcome.
Yeah, the same thing likewise here at Ikotun, very near the roundabout. Is also the same thing we are witnessing here. It's very bad at the health center.
The health center there is bad as well. Is there a name? Is there a name for the health center? Can you remember?
For sure, something I forgot them.
Oh, okay. All right. If we could get the name now, it would have been very easy to follow up with. But it's okay. But what makes it bad? What did you see? What did you notice?
The environment is there, everything there, the way it was structured, and but no, when you fall, if you enter for, you would think it's a nice place and this thing.
Yeah.
So you get inside very well. That's why you see that it's not what you are seeing from outside.
What exactly? You've not mentioned, pinpoint observation.
I mean, the place is not tidy enough. Everything is it's not tidy enough at all.
Well, is there water? Is there running water?
According to what she told me, she has not been seeing water there.
Who told you that? Your wife?
Yes.
Okay.
And it's not accessible for now, because of all this corona.
Michael, thank you for sharing your thought. I mean, yeah, this is what Wemimo's report is meant for. It's an advocacy thing that we bring up issues to light and let the government actually see clearly things that they're supposed to attend to. And I'm glad that we're getting feedback, from Lagos this morning. The two calls that we've received thus far are both from Ikotun. Yeah, both from Ikotun, Okerube, Ikotun, Abaronje. The other caller, too, called from Ikotun. Michael called from Ikotun, but he couldn't give me exact location of the health center he was referring to. Be that as it may, we'll continue. Let's go to break right now. After the break, we'll take more of your calls and let's know how the health center, it doesn't have to be bad. If the health center in your area is okay for you, let us know as well. It doesn't have to be negative. No, that's not the purpose. The purpose is to talk about the true situation of things around us. Welcome to the Morning Crossfire once again if you're just joining us. I'm Sheriff Quadry, and I'll be right back.
Have your say in what we say.
You always make good points.
We talk the talk, and walk the walk. We are 99.3.
You talk, we listen.
Nigeria Info.
Hello, my name is Ronke from Ikorodu.
Hi, I'm Emeka from Festa. My name is Ahmed from Apapa.
I want to tell you about my radio. My radio is my best friend.
My steady companion.
My radio keeps me informed
all day long
with hot topics,
trending news,
politics, and current affairs.
My radio gives me the best music.
My radio is
Nigeria Info.
Everybody in Nigeria listens to Nigeria Info.
Did you know?
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 Did you know? Did you know?
Did you know?
Personality. Akinwande Oluwole Wole Soyinka. Akinwande Oluwole Soyinka was born on the 13th of July, 1934. He is a Nigerian writer, notably especially as a playwright and poet. He was awarded the 1986 Nobel Peace Prize in Literature, the first African in Africa and the diaspora to be so honored. Soyinka was born into a Yoruba family in Abeokuta. After studying in Nigeria and the UK, he worked with the Royal Court Theatre in London. He went on to write plays that were produced in both countries, in theaters, and on radio. He took an active role in Nigeria's political history and its struggle for independence from Great Britain. In 1965, he seized the Western Nigeria Broadcasting Service studio and broadcast a demand for the cancellation of the Western Nigeria regional elections. In 1967, during the Nigerian Civil War, he was arrested by the federal government of General Yakubu Gowon and put in solitary confinement for 2 years. Soyinka has strongly criticized many Nigerian military dictators as well as other political tyrannies, including the Mugabe regime in Zimbabwe. Much of his writing has been concerned with the oppressive boots and the irrelevance of the color of the foot that wears it. During the regime of General Sani Abacha from 1993 to 1998, Soyinka escaped from Nigeria via the Nadeko route on motorcycle. Living abroad, mainly in the United States, he was a professor first at Cornell University and then at Emory University in Atlanta, Georgia, where in 1996 he was appointed Robert W. Woodruff Professor of the Arts. Abacha proclaimed a death sentence against him in absentia. With civilian rule restored to Nigeria in 1999, Soyinka returned to his nation. He has also taught at Oxford, Harvard, and Yale. From 1975 to 1999, he was a professor of comparative literature at the Obafemi Awolowo University, then called the University of Ife. With civilian rule restored in 1999, he was made professor emeritus. Soyinka has been a professor of creative writing at the University of Nevada, Las Vegas. In the fall of 2007, he was appointed professor in residence at Loyola Marymount University in Los Angeles, California, United States.
Did you know?
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 Did you know? Did you know?
Did you know?
This is Morning Crossfire on 99.3 Nigeria Info.
99.3 Nigeria Info. Welcome back to the Morning Crossfire. Yes, we're having a conversation about the state of primary healthcare centers in Lagos here. I am asking the questions, what is the state of primary healthcare center in your neighborhood? It's very, very important we have this conversation. And thanks to Wamimo Adewuni's report on the primary health care situation in Ashogbo, following her series that she just started called Where is the Water? That particular report is titled Lagos Health Center Without Clean Water. You can check it out on our website, nigeriainfo.fm. That is nigeriainfo.fm to read up on that particular report. Straight to the point, short, concise, detailed, well detailed with pictures as well to tell you exactly what we are dealing with in some parts. And this morning thus far, we've had two callers from Ikotu, and the both of them lamented the situation of two healthcare centers in Ikotu. Let's see if we got a caller here this morning. Hello, good morning to you.
Hello, good morning.
Good morning.
I'm Bello calling from Ogun State.
All right, Bello.
Please, I want to play the Just a Minute game. I've been calling for...
No, you can't. It's not played that way. Thank you for calling. Appreciate it. Hello, good morning to you.
Good morning, Sheriff.
Good morning.
This is Abednego.
Welcome, Abednego.
Thank you. Currently, I have not been to the health center in a very long time. But I don't know if it's safe to say COVID is opening our eyes, or this period is opening our eyes to a lot of things.
Yeah, sure.
Because this would have been happening and would still be happening, and nobody will find out about it. But I feel like now we are waking up to a lot of things. This is where the government comes to play, waiting them to do things. Because that's one question we need to ask. What government is doing? Now, imagine this beautiful report being done by Nigeria Info. Shouts to Wemimo for it also. Now, something will be saying if government put their eye down since they would have found out a long time ago.
Right.
But what are they doing? Where have they ever gone right in stuff that they do? And the problem is, I don't know, I stand to be corrected. I just hope that as much as they listen, they act. Because it's always painful when they pretend like they don't listen to these shows. It's always painful. So imagine now someone goes to a healthcare center as such, and then they cannot speak up, maybe because of the fear of waiting will happen or one thing or the other.
Right.
A brave one for Nigeria.
Yeah. Thank you, Abednego, for calling me. I want to hear from mothers. Mothers, if you've been to the primary health care center, even if you're a guy and you've been there before recently, I want to know what you saw. Exactly. Daniel joins us right now. Hi, Daniel. Good morning to you.
Good morning.
Good morning.
Yes, I'm calling from Badagry.
Welcome, Daniel.
Yes, sir. To be honest with you, the primary health centers we have in Badagry, they are up to standard.
Nice.
Yes.
Nice.
You the one in Ajara, Badagry town, Apa, Seme, they are up to the standard. But what I'm expecting from you, the journalists, because I believe that God can make use of you to make some wrong things to be corrected, is to continue in exposing these health centers, even the one in the general hospital, the atrocity that have been taking place there. If you can continue to expose them, at least government can come to the aid of the commoners so that these health workers will be able to do the right thing and attend to the patients the way they are expected and with the oath they took when they are being called into the service.
Thank you, Daniel. Let's speak with Ben. Hi, Ben. Good morning to you.
Good morning, Sheriff.
Good morning to you.
Sheriff, first of all, I want to thank God today that I finally got you on the line.
It's good to have you here, finally.
I really want to go to say thank you very much.
Thank you, too.
I don't want to waste time, but I would like to get your private number. I want to send you a recharge card, honestly. Honestly, I want to do that, but you really fast. I don't know how to appreciate you. Sheriff, about the primary health center you are talking about, isn't that we don't have any other topics to discuss today? Sheriff, in Asoro, Asha Buhari said there is no.
No. We are not talking about any other thing today apart from the situation about health is everything. Come on. Health is everything. Like everything. In some place, elsewhere in the world, some place, health is what they prioritize. Their healthcare system is what because it saves a lot. It saves the cost of healthcare. It's human, it's material, it's financial, it's resources, everything. If you can provide a standard healthcare for your people, your problem is half solved. And you're now saying that don't say that. Don't say that again, please. I beg you. Please just don't say that. Okay, let's speak with Zubair, I think. I'm not sure how your name is spelled. Hi, good morning to you.
Thank you, Sheriff. It's Alaji Zubair.
Alaji Zubair.
Thank you very much. Sheriff, can you just give me the opportunity to just comment on your first topic?
No, we are not going back.
You are not going back.
Yeah, we're talking health.
Just
No. We're not. I'm sorry.
All right. The health center issue.
Yes.
It is not the gigantic building that matters, but the operational system of the health center.
Exactly. What goes on inside?
What goes on inside? You understand?
Right.
If you heard of a case that happened in our environment here, the health center is called Aregbesola Health Center.
Okay.
Where a woman wants to deliver, but because of the attendant, the reception, the woman passed away.
What part of Lagos is that exactly?
That is Alimosho.
Alimosho.
Yes. Aregbesola Health Center. That
Okay.
is last year. It was announced. This was in fact, I learned to investigate the cause of the issue. But you see, when we are talking about it, it is not the gigantic building, but the attitude of the workers there to the patient, even if you don't have drugs. But you see, somebody who is ill, you need a kind of perseverance, consolation. You understand?
Right.
And these are the kind of ethic that they have given to the workers there. So you see, it boiled down to remember our former governor, Fashola.
Right.
That is what led to dismissals of some people in general hospital.
Mm-hmm.
When he went there very early, they did not expect him. So, you see, that is what I want the government to look at. It is not the building by, the luxurious or whatever, but the community
treatment
from there,
right,
and the equipment per se.
Right.
And when you look at what's it so-called, health center per se, you spend money. It's not free. Whatever you ask you to pay this, pay that. So people will be thinking that maybe it's free. That's why some people even decide not to be going there. They prepare for, okay, let me go and spend my money in the private hospital.
Right.
If that is the position.
But it is supposed to be free, actually, according to what I'm seeing here in the Basic Healthcare Provision Fund. It is supposed to be free. Alhaji Zubairu, thank you. Let's speak with Samuel, who is in Ojodu Bega. Samuel, good morning to you.
Dr. Sheriff, good morning.
Doctor again. Good morning to you.
Yeah, I'm Samuel.
Welcome, Samuel.
Calling from Ojodu Bega.
It's good to have you.
What I'm trying to say is that our government, they are not sincere.
Okay.
When a president will have a headache, he will go to abroad to treat a headache. And a governor will have a malaria, he will travel abroad for malaria, to treatment of malaria. How can it be ordinary healthcare, not to talk of general hospital? I went to Bagada General Hospital. My brother died there. It was in May. You understand me?
Sorry.
If you go to the so-called health center we have around Lagos State, it's supposed to be the best. You understand me?
Yeah.
But here in Lagos, even to access the road to that healthcare is another problem.
Samuel, you need to see the report Wemimo did. The state of road. You go to our website and see the pictures. The road is horrible.
The truth. Come to Ojodu Healthcare. He's nothing to write home about. And the Lagos State have the money to do all these things.
Right.
Because they are there to inherit, they will just to enrich themselves and their godfathers. That is why we are suffering. Health is wealth. But they don't care. They don't care about the citizens. They are after their life, their children.
Samuel, thank you. Let's speak with Additional. Additional, good morning to you.
Yeah, good morning.
Good morning to you.
Additional.
All right.
From Baduri.
You're in Baduri. Welcome.
Yeah. Mr. Zerif, let me first say this. Please, I'm appeal to our listener and the callers. They should always stick with the topic and the modality of topic. When they said, tell us your experience of one of the center that you went to, and people start talking politics.
Thank you.
So I don't see reason for that. Please, from now, anybody, just call us based on your experience.
I'm trying to be nice now. Okay.
Well, I understand, but sometimes that's when what's the name of this woman in the evening?
Sandra.
Took that decision. Once you go outside, they caught you. I like that woman. So please, let's always do that. Anyway.
Okay.
I personally, I visited the Badore Health Center.
Right.
At least 3 times, different occasions.
Okay.
On my own, on my children,
okay.
And recently,
right.
On my wife.
Right.
And most time, I try to go there together with them. Okay, sincerely in Badore, some people have another perception.
No. I mentioned. I've been there too. I mentioned it earlier. That I mean,
I remember that you mentioned Badore.
I'm satisfied. Yeah,
it's one of the, if not the best, is one of the best in Lagos State. Though we still have some other areas that we want them to work more.
Of course.
And recently, in the area of human resources, they changed most of them, and at least we see different in people who are there now.
Right.
From the attendants, from the nurses, from the assistants,
right.
They were sincerely, they are good. And somebody mentioned money. It's very clear that they did not collect money for treatment. They only pay money for test.
Okay.
I noticed that. I went there.
Okay.
The first thing is get there, you pay 100 naira if you did not have card.
Okay.
After that, they schedule you to see doctor. Nobody collect any money from you. Doctor, based on the symptoms, doctor will recommend test for you.
Okay.
You went there, but you pay for test. And that is where the issue lies. It's like the same amount that they charge outside is what they charge there.
Okay.
So if there's anything they can do, I think it's PPP or something like that. The government subsidize that test for us.
All right.
That would be okay. But
Brilliant.
The doctor, they are trying.
Brilliant.
In the area of water, well, they have water there, but the water is not always. It's not always that they have that water. If there's anything they can do, we have water something close to the place.
Yes.
Sometimes there is no water there, they will not see water.
Okay.
So I witnessed something that I'm not okay with, which I would like the administrative the people in charge to work on.
Right.
There was a day I was there for stomach or something. On my treatment bed, there was a lady that they brought. That lady is I think is a asthmatic patient.
Okay.
And unfortunately, they did not have fuel in their generator. It took the nurse to take money from her pocket to go and do that. And when people brought people to hospital, the way we were outside, we want them to start treating them now. And the nurse is trying to explain to the person that followed this lady that what you are here for, we need the light. And there's no light, there's no fuel.
Right.
I use my money, and from there they have quarrel. And the lady say it out that we don't have no fuel here. It is my money that I'm trying to send to go and buy fuel. Please, all this until people intervene, the lady uses money. Some people later give money back, and at the end of the day, they were able to take care of the lady.
Right.
So, but they need to help us work on that.
All right,
and I
additional.
really appreciate Lagos State and Etiosa East in particular.
Thank you.
The same thing, the one at Owode, I've witnessed something there. We have brought an accident there, and I see the way they respond. And they have what it takes.
Thank you, Additional. I appreciate it. Madam Ify has been on the line for some time. Madam Ify, good morning to you. Thank you for holding the line.
Okay, now. Good morning.
Good morning.
Well, I'm not a user of government hospital. But when I remember when we were younger, in the 60s, we used to use the health centers that almost look like an hospital.
Okay.
Like then Radu Health Center. That's what we know it in the 60s. But I understand they've turned it to general hospital. So this, how will I call it? Small health center they are building now. I don't think they will have all the facilities.
Okay.
There. Like me, on the Road, there's a health center where they demolish the building and rebuild it. Beautiful.
Okay.
Clean.
Okay.
But I don't know what is happening inside. But I know that I see women with babies.
Okay.
I look at it as if it's an immunization center.
Right.
Right. And that's the way I look at it.
Right.
But not far away from there, you will meet a general hospital.
Okay.
You understand?
Yeah.
So.
Thank you for this.
It's not by building.
Yeah.
They should equip it, and the nurses too should stop delivering drugs away from the hospital.
Pilfering.
And they should make it affordable for the common man.
All right.
All
right. Thank you, Madam Ify.
I've never been to a general hospital when I was bringing up my children.
Okay.
But first, I will take this opportunity to commend Latut. Latut is one of the cleanest, hygienic general hospitals I've ever entered. I lost a friend there. But the environment was super.
Yeah.
Yeah.
Thank you, Madam Ify. Appreciate it. I mean, I'm glad. I am so glad that this reaction, feedback is coming in from people at this time. Let's speak with Temitope, who is in Shomolu. Temitope, good morning to you.
Yeah, good morning, Sheriff.
Good morning.
Good morning. This is Temitope. I'm calling from Shomolu.
It's good to have you.
Yeah, thank you. About what we more talked about this morning. I live close to that area. The Ashobon Health Center. It's an eyesore. The our last baby, the one we had, my wife wanted to go there to register.
Okay.
Even in that same health center, the local government agents also have offices there.
Okay.
Right from the gate, you will not consider that as an health center. Even there's just as you stand in front of the health center, you see an heap of waste gathered there. You wonder, is this an health center? Very bad. Where she later went to the one close to Paco bus stop, where she registered and did an antenatal and then eventually gave birth. At that health center is a perfect place.
Right.
That they had all the facilities meant for the baby and the mother. State of the art facilities. And one other thing, after delivery, and delivery is free of charge. You are not paying a dime. And they have doctors. And night shift, there are 2 doctors, and all the nurses were on ground. We were there throughout the night, and the morning we were discharged.
For deliveries, no payment.
No payment. Not one kobo.
Fantastic.
No, not one kobo. My wife just left the room now. I would have asked her the name of the. I think you have asked her. So it has Paco bus stop. It's close to.
I know Paco now. I know Paco very well now.
Yes, there's an health center there.
Yeah.
And there's one at CMS primary school that Sanwo-Olu came to commission early this year. That was also good. And there's one in Shomolu, Ambode Health Center. All those ones are good. But this one at Yashobon, wow. I think
have you been to the one that we did the report, the Ashokbon one? Have you been there before?
That is the one I'm talking about. I've been there. It's very close to my house.
Oh.
Yes, very close to my house. There's this market, Oduero.
Yes.
It was renovated. The government wanted to work on that health center. Somebody.
Yeah.
The change of government affected that. There's the canal they are doing at the back of the health center. It was blocked. In fact, the last rain that fell, all that area was covered with water.
Oh my word!
Nothing was working.
I'm looking at the picture that Wimo put in her report now, and I'm marveled at how a health center can be in that state. Let me talk about. Thank you. AJ is here from Ikoyi. Hi, AJ. Good morning to you.
First and foremost, sir, thank you for giving me the audience.
Thank you, AJ.
I've always loved you.
Thank you.
I've always loved you.
Thank you, AJ.
And I miss that outside of you. You always, put across to us as some education.
Thank you.
I don't know why it's so. Then about that issue of this primary health thing.
Yes.
Alaji Sube spoke my mind. It is not the building that counts, it is the personnel. You see, most of them do not know that we are equally educated, but not all of us should be doctors or should be doctors. They are heartless. If you bring 100 Nigerian doctors, I'm saying it and I have all evidence. If you invite me down, only 5% are human and are humane. Do you get me?
I'm with you completely.
They look at you as if you were some burden to them. They don't justify the Socratic oath they took. I've walked in their midst. They are heartless. Heartless. I'm telling you this. I can prove it to you. That is why a person fears to go to them. Because I see no reason why you should be having some ailment and be, afraid of going to see the so-called doctor.
Right.
That must provide you with solution.
Right.
Please let the governor do what Fashola used to do. Fashola will shock them unknowingly.
Okay. And just visit them without announcing.
Exactly.
AJ, thank you so much for calling me. I really do appreciate it, but we're out of time actually. Emeka, apologies. I can't take your call. Apologies for that. But because we have to play just a minute.
It's It's entertaining, exciting, and puts money in your pockets. It's Just a Minute, a game show brought to you by 99.3 Nigeria Info. Call in to any of our shows, The Morning Crossfire, What's Up Lagos, The Sunny Side, and The Hat Facts, and answer as many questions as possible in just 60 seconds. And we'll be giving out 10,000 naira every day. Winners will be announced on Hard Facts with Sandra Ezekwesili. Just a Minute, the game show for everyone, right here on your number one station for talk, 99.3 Nigeria Info. Let's play, let's win, let's talk.
0700 993 993 993. It's time to give out 10,000 naira on the Morning Crossfire. Congratulations to everyone that won last week. The guy that won on Friday, you should get your payment this week because it was Friday. So you get your payment this week. But every other person has been paid. So, yeah, congratulations to you if you have won before in just a minute. But right now, let's play. Remember, 60 seconds is all you've got to play just a minute. Just 60 seconds. You can answer as many questions as possible. Here we go. Lagos.
This is Just a Minute on 99.3 Nigeria Info.
Hello, good morning to you.
Good morning.
Good morning. What's your name? Your name is? What's your name?
Hello?
Yes, what's your name?
Emmanuel.
Emmanuel what?
Daniel.
Emmanuel Daniel. You want to play just a minute?
Yes.
Okay, quickly. Give me the last 4 digits of your number. Quickly.
0879.
0879. And the first 4 digits. Oh, what?
0803.
0803. Emmanuel, 0803, right? Okay, so let's play, Emmanuel. Let's play.
This is Just a Minute.
Emmanuel, who was my guest on the Morning Crossfire this morning?
Olatunji.
Who is APC governorship aspirant in the coming Edo election?
Osage Yamo.
Okay. What's the title of the latest advocacy documentary series by Wemimo Adewuni?
Primary health care, no water.
Okay. Nigeria's public debt is now what amount?
$27 trillion.
When will federal government decide on interstate travel restriction?
At the end of this month.
How many Imo State lawmakers recently tested positive to COVID-19?
Hello?
How many?
5.
5. Okay. Daniel. Emmanuel Daniel, right?
Yes.
So you were able to get one answer correctly. It's possible that you will still win. We have seen somebody that got just one answer and he won 10,000 naira. So what you're going to do is send an SMS with this number. Send an SMS with this number to our WhatsApp line. Do you have our WhatsApp line?
No.
Do you have our WhatsApp number?
No.
Okay, the WhatsApp number is 0809 597 5805. That's right. That's our WhatsApp number. Send your full name to that and your account details as well. It's possible that you would win. All right. So Lagos, that's the show today. That's the Morning Crossfire. Many thanks to Wemimo Adewuni, Senior Editor, Advocacy and Gender Issues here on Nigeria Info. Amazing report. You should go to our website and go and read up on that report. It's quite revealing. It's explicit. Lagos Health Center without clean water. Our website is nigeriainfo.fm. That is nigeriainfo.fm. Go there and read up on that report about a health center in Ashogbon, Oduero Bariga, where there is no water running, and it's called the health center, especially in these times of COVID-19. I'm Sheriff Quadry. You can follow me on Twitter at Sheriff Quadry, on Instagram as well at Sheriff Quadry, on LinkedIn at Sheriff Quadry, everywhere. Just follow Sheriff Quadry. I'll be back tomorrow at 5. In the meantime, Colin Stecker will be here on What's Up Lagos. Stay here.